Please welcome Dr. Gupta from ANP Foot and Ankle Clinic. Great to see you.
Same here.
Well, we've talked about a lot of different things. You know, we've had the laser toe procedure and different orthotic heels and working with kids. And today I think we're going to talk a little bit about some sports injuries.
Yes, you know, sports injuries is one of those things that, especially this time of the year, there's all kinds of sports going on, the baseball, the softball, the,
RAGBRAI, biking.
Biking, yeah. And especially with younger people, kids, teenagers, you have a little bit of injury, a little bit of ache and pain, or twist your foot or twist your ankle, and but a lot of our kids are so into sports that they wouldn't pay attention to some of that stuff, or take a couple Tylenols or a couple Advils, and you kind of go on your way, or you go pick up a ankle support or arch support or something off the shelf and try that out. Yeah, if those aids, those things, those supports are not fitted correctly, then they're not going to provide the kind of support that you need. I mean, you think of the foot and ankle, you're talking about hundreds of ligaments in a foot, more than 20 muscles in a foot that control the foot and function, the 33 some joints in the foot.
Wow.
So if any of these joints is sprained a little bit, or a ligament is partially torn, and if it's not supported properly, it may tear more, or the torn part will callus up or scar over and will sort of never heal together. And so it becomes very important for these kids to have proper support, proper care, and allow those tissues, those ligaments to heal. A good medium type of injury will normally heal in 2 to 3 weeks when taken care of properly. And if you don't take care of that, sometimes you're going to go for months and may even get into a chronic type of pain. I see kids, who have chronic ankle sprains. Every time they happen to step a little bit wrong, they get a sprained ankle or a swollen ankle or foot. And all that stems back to some injury somewhere that did not get taken care of properly.
And, you can have an injury and think that it's fine, and maybe just say, oh, I have a weak ankle or a weak knee, and not realize that it's something more serious. And that's when visiting someone like yourself is so important.
Yes, it is. And it all basically comes down to, when you have a sprain, when you have an injury like that, those tissues need rest. Those tissues need some support. Those tissues need some type of physical therapy, be just, icing it, or maybe doing some ultrasound therapy, or some whirlpool therapy, or stretching exercises, or range of motion exercises, or some type of anti-inflammatory, Aleve or Advil, or some other little more potent, depending on the type of injury you have. So those are the 4 factors, rest, support, anti-inflammatory, and compression, or physical therapy type of things that, when you use them immediately after the injury, you're going to decrease your healing time significantly and have your foot and ankle stronger.
And you can help a range of people, all ages, at your location on the south side. Tell us where.
Yes, we have 6053 Southeast 14th Street. We also have an office in Indianola.
Great.
And we split time half and half in between the 2 offices.
It's great to see you again. Thanks for being here.
Thank you.